Good afternoon. Today I am going to be talking about the psychological disorder is bipolar type 2 disorder. I have chosen bipolar type 2 disorder because I have been diagnosed with that when I was in my early 20s. As well as depression, ADHD, schizophrenia, general anxiety disorder, PTSD. I have been on every antidepressant, mood stabilizer, benzo, and pain pill known to man. During the time of my bipolar, I would do such things such as go writing bad checks, moving from state to state, leaving my husband, lots of jobs. The antidepressant and mood stabilizers wouldn't work, or so I thought, so I would try pain pills. They took everything away, so I resorted to pain pills. I got addicted to the pain pills for about 7 years. I had just gotten out of a rehab and I started taking Xanax. The Xanax made me black out, and I ended up getting a driving under the influence. Let me say, during this time, I was in an awful relationship that did not help my bipolar depression. After being in jail for a few days, I got on a program that was supposed to help. It was a pill called Suboxone. It was supposed to be like a miracle drug to help me get off the pain pills. Let's just say to this day, 10 years later, I'm still on the Suboxone. But I left my son's dad. I have been living in a stable life with an apartment, job, car, all being able to raise my 2 sons. During this time, my younger son, he was born on the Suboxone and did have to wean off. It made me feel horrible, and my doctor did say I may have to be on this Suboxone for the rest of my life, but this is the best I've ever done, and I don't ever want that old life back. So today let's cover what we will be covering: the symptoms about bipolar 2 disorder, how it is diagnosed, and the treatment methods. There are 4 types of bipolar disorder: bipolar 1 disorder, bipolar 2 disorder, cyclomythic disorder, and other specified and unspecified bipolars and related disorders. With bipolar type 2 disorder, there are patterns of depressive episodes and hypomaniac episodes, but not the full-blown maniac episodes. It is said to be a lifelong illness. The symptoms are major depressive episodes lasting at least 2 weeks, feeling sad, down, empty, hopeless, trouble concentrating, at least one hypomaniac episode, being agitated all the time or irritable, feeling jumpy or wired, flying suddenly from one idea to the next, having exaggerated self-confidence, increased energy with hyperactivity, and decreased need for sleep. Now, how they diagnose this: you would go talk to a doctor or licensed mental health professional. They would do an exam to rule out any other conditions that you might have. If they do decide that you have a mental health disorder, they would refer you to a psychiatrist who is experienced in diagnosing and treating the disorder. That psychiatrist would then conduct a mental health evaluation. Treatment methods: beneficial treatment plan. It can help the patient gain better control of their mood swings and symptoms. Medications can include mood stabilizers, atypical antipsychotics, antidepressants. Psychotherapy can include cognitive behavioral therapy, family focus therapy, interpersonal and social rhythm therapy, and psychoeducation. Also ECT, electroconvulsive therapy. That can provide some relief for extreme bipolar disorder who have not been able to recover. Inpatient treatment, that would help you if you're experiencing, your mood is particularly unstable and you're experiencing psychotic or suicidal thoughts or behaviors. The goal of that inpatient treatment is to get you stable on medication, get your mood stabilized, and connect you with the needed outpatient support. Dual diagnosed treatment. That is people that with bipolar who also experience drug or alcohol disorder. If you have a family or history of substance abuse, you might benefit from the dual diagnosed treatment. Nature or nurture. Scientists aren't exactly sure what causes bipolar disorder, but they take into several risk factors such as genes, brain structure, and environmental causes. Some studies have been shown the brain of people with bipolar may be different from the brains of healthy people. Identical twins even though one twin gets the bipolar, the other twin doesn't, even though they have the exact same genes. That is very interesting. Stress can play a huge predictor of bipolar disorder. Life events such as death, job loss, childbirth can trigger a mood episode. I know with me and my bipolar, when me and my ex would fight, we would drink, we would do drugs. It just was not a good combination. Now that I'm on my own, I have a job, I eat healthy. My moods are nothing compared to how they used to be. It's amazing. Psychology is a very important field, and they offer great support to people that need it. I have lived with mental illness a large portion of my life, and have worked at the psychiatric hospital and outpatient clinics for 4 years now. This course has helped me by learning deeper meanings of behaviors, the different psychotherapy meanings. I know our facility has grown so much over the 4 years. This course is going to help me to understand what psychotherapy means. I know we have a lot of patients that go to the different meetings every day, and now I kind of know what those meetings are about and what they might be doing in there. I know when I was going through my decade-long bipolar episode, I would go to different counselings, but I would change them so much I would never follow through. I now appreciate how much our patients come week after week to try to treat this. I think with the right medication and counseling, people can learn to manage their symptoms. Thank you.